Hi, everyone. My name is Jillian Parker, and today I'm joined by Dr. Mary Rose Lagiovilla, who is an infectious disease specialist at Rochester Regional Health, to discuss what is arguably the hottest topic right now, the COVID-19 vaccine. People have a lot of questions. There are many theories, assumptions, false information being spread on the web, and I know still some unknowns. So we're going to talk about the vaccine safety, potential side effects, how it came to be. Dr. Lagiovilla, thank you so much for joining us today.
Thank you, Jillian.
And I just want to open it up and let everyone know who's tuning in that you are welcome to leave any questions you have in the comment section. I will circle back around in the end to ask Dr. Lagiovilla some of those questions, and we'll try to get them all answered for you. But Dr. Lagiovilla, I just want to jump right in because there are so many questions that people are interested in knowing more about. And one of the main things I'm seeing online is, how did the vaccine come to fruition so quickly? The biggest argument out there seems to be, it can take years for other vaccines to be approved. Why has this vaccine been approved in less than a year's time? And ultimately, why should I trust it?
Oh, okay. I will try and answer this question piece by piece. And I think it's a really good and valid question, right? We have not had a vaccine that uses an mRNA before. But the research that's been going into mRNA vaccines goes back to over 20 years ago. And when it came to Ebola, the Ebola vaccine was using a platform similar. Now, it seemed that when the pandemic was starting, the scientific community knew that we would need to have a vaccine that could be mass produced in large quantities. And we may traditionally think about the influenza vaccine. But the challenge with that is that because it requires eggs for production and it requires a very long lead time, that was an undesirable platform for us to get a large volume of vaccines distributed worldwide. So the research for mRNA vaccines goes back many decades. And I think because we already have preliminary information on this vaccine platform, it was a good starting point. Mm-hmm. Now, when the pandemic started, within days of identifying the viral genome, there was collaboration among the CDC, the National Institutes of Health, which is the NIH, as well as the Vaccine Trials and Evaluation Units of the NIH, the VTEUs, and many others in the scientific community, as well as in the pharmaceutical industry, with the understanding that, we have a unified goal to focus solely on developing a coronavirus vaccine. So I think that contributes to the speed of development. When you have so many people, so many groups which have decades experience in vaccine trials focused together on one goal. And in addition, they knew that the urgency, because the pandemic had such horrible ramifications across the globe, they needed to have an accelerated timeline. So what they did is typically they start with phase 1 trials for vaccine development. So they know what will be the ideal dose and early safety signs. And those are in small groups. Now, when you have so many institutions around the globe recruiting patients, you can accrue a good amount of baseline population to get your phase 1 information set. Now, fortunately, at Rochester General and also from the University of Rochester, we also had a community that was so enthusiastic to participate that we had very little challenge with enrolling enough people into our phase 1 trial. And in the development of the phase 1 trial, we looked at multiple dosing and constructs of the vaccine to compare against placebo. So I think in other times when you had to do vaccine development, you may only look at 1 or 2 vaccine constructs against placebo, and your accrual to get patients to participate is slow. But here we have many people who are interested in volunteering to be part of the vaccine study, and you have multiple constructs that are being developed in parallel. We were able to get that information from phase 1 to have adequate numbers of people to make some decisions on what the ideal construct would be within a matter of weeks. And then a modification of the typical vaccine strategy that happened with coronavirus is that they also wanted to implement phase 2 and phase 3 together in rapid sequence. So you take a bunch of healthy volunteers, and then you start to include also others with at-risk factors. So over a very short period of time, we still have an enormous amount of individuals, patients, where we have real information on. So for Pfizer, in a matter of 6 months, we have 44,000 participants across the globe. For Moderna, there's 30,000 participants. And although the time seems quick, to have so many individuals that are involved and so much data that you could feel confident that these are true results has really helped us know so much in a relatively shorter period of time.
Now, to put it into perspective, is there any way to compare in terms of getting the vaccine, the flu vaccine to the Pfizer vaccine?
So to compare and contrast the two, let me talk about the type of immune response that's elicited first. So with the influenza vaccines, they use the protein that's a part of the virus, not the virus itself, but just the protein that is in the vaccine that's injected into the individual, and then that person's immune response is specific to that protein. So that's for influenza vaccines. For the COVID vaccines, it uses something called mRNA. So M stands for messenger, and then RNA is some genetic material. And all of our cells make mRNA, and they're really the molecules that give the information to the cell of what kind of proteins to make. So in contrast to the influenza vaccine, in which we just give the protein of the flu, the COVID vaccine gives the instructions to our cells to make that protein. And when it makes that protein, then it stimulates the immune system to make the antibodies directed against it. Now, for these mRNA vaccines, the mRNA, once it's injected, gets degraded just as all the other mRNAs in our cells get degraded by the same enzymes in all of our cells, and it generally gets degraded relatively quickly. So that would be, I think, the first important distinction between flu vaccines and COVID vaccines. A second difference would be that, one, the dosing strategy. So flu vaccines is a single dose, and generally it's annually. The reason it's annually is because sometimes the circulating flu viruses differ enough that we need a brand new vaccine every year. Also, the durability of the antibodies that our bodies create in relation to the influenza vaccine wanes over time. So it doesn't last for years and years. For the COVID vaccine, the dosing strategy is first dose followed by a second dose, either 3 or 4 weeks later. Mm-hmm. The Pfizer vaccine is recommended 3 weeks later. For the Moderna vaccine, is recommended 4 weeks later. So the reason behind that is that it also was part of some of the phase 1 studies. They wanted to see what were the antibody responses. And so when we do these trials, we test individuals for what is their antibody response after the first dose, and if there's a benefit of giving a second dose afterward. And we observe that there is a benefit of having a 2-dose series.
Now, when it comes to the flu vaccine, I know there's a lot of information, false information spread about. People think that if I get the flu vaccine, I'm going to get the flu. So kind of turning that on the COVID-19 vaccine, if you take the Pfizer vaccine, which is the only one available still currently, I know we have Moderna possibly on the way, but can you get COVID from taking the vaccine?
No, you cannot get COVID from taking the vaccine. Again, because it's really just the information to make that one protein part of the virus. It is not in any way contains live virus. It doesn't contain any inactivated virus. So you cannot get coronavirus infection from coronavirus vaccine. Similarly, receipt of the coronavirus vaccine will not make a coronavirus test by PCR positive. So if somebody were to get the coronavirus vaccine and then develop some symptoms that could be concerning for coronavirus infection, and they went for a nasal swab for the PCR, it will not be impacted by the vaccine.
Should people be concerned about having allergic reactions to the vaccine? We know that it can happen, with any other vaccine, depending, obviously it's a case by case, person by person basis. And a report came out today about someone from Alaska who had some type of reaction. How can people know what to be on the lookout for, or what to be prepared for in terms of reactions to it?
Right. So I think it's similar to any other new medication. If it's a new medicine that we haven't had that type of medication or antibiotic or therapeutic before, it's very difficult to predict if somebody is going to have an allergy to it. It would be one thing if the COVID vaccine was very similar to some material that somebody is known to be allergic to, but it is very different. So I think I'd say that if there is an individual who has had in the past a severe allergic reaction to a prior vaccine, that might be a discussion to have with their their primary care provider. According to the Advisory Committee for Immunization Practices, the ACIP, in general, if you have a high frequency of allergies or are very allergic to many things, like a litany of medications, again, it might be a conversation you might want to have with your primary care provider. But if you have a single allergy, for instance, to mold, that's really not enough to say you shouldn't get the COVID vaccine. If you have a concern for having an allergic reaction, again, like there are ways that you should inform and talk with the people who could provide your vaccine. But I think overall, the likelihood of having a severe allergic reaction is extremely small. We know of individuals who have been in these trials, and the frequency is far less. And I think when we're talking about adverse reactions to a vaccine, it's important to balance that against, well, what is the frequency or the likelihood of you having or catching coronavirus? So if the likelihood of you catching coronavirus is high because, for instance, you're in healthcare or you're a frontline worker, and you see many individuals where you may not be able to know what their COVID status is or don't have a lot of access to PPE, well, the chance of catching coronavirus may in fact be larger than having a reaction to the vaccine.
If someone has a particular health condition, does that at all change? Should that change their level of caution going in to get the COVID-19? Should they be considering some of that?
Well, I'll say that I think that question about what is my own self-risk goes into anytime you take any other new medication. What am I likely to benefit from it, and what do we already know about this medicine? For the clinical trials, for the vaccines, people who had extreme immunocompromising conditions, many of them may have been excluded. So we don't have a lot of information per se. But that being said, if there are you're high risk of contracting COVID, and you have a condition in which if you contracted it, you're more likely to have severe disease, well, then I think the advantages of taking the COVID vaccine are outweighing any of the risks. It should be known that if you do have certain immunocompromising conditions, it may affect the ability of your body to make an adequate antibody response. But I don't think that necessarily means that there's more risk to that individual to get the vaccine.
Now, I just want to, for everyone tuning in, if you're just tuning in, just want to reintroduce Dr. Mary Rose Lagiovilla, who's joining us today. She's an infectious disease specialist with Rochester Regional Health, and we're talking all things the COVID-19 vaccine, as so many people have a lot of questions. Some of you have written in some of your questions, and we'll be circling back around in a little bit to get to some of those. For anyone, again, just tuning in, feel free to leave some questions in the comment section, and we're going to get to those in a little bit. Dr. Lagiovilla, we know that 2 doses of the shot are necessary for the vaccine to be most effective. You touched on it a little bit, but can you explain why exactly it is necessary to have 2 doses of it?
Oh, sure. The value in getting 2 doses is that there's some antibody that may be produced after the first dose, but after the second dose, it's clear that recipients develop antibody at such a high level that it's comparable to having had COVID infection before, if somebody had COVID infection. So in these studies, they measure antibody levels after the first injection and then after the second injection. And then they're able to compare it to volunteers who had natural COVID-19 infection. And so that's what we would try and mimic by giving a vaccine, right? We want to have that type of innate protection, but without the disadvantages and the damage of having actual infection.
And we talked about potential side effects a minute ago, saying, it is low risk for any extreme side effects. Do we know if there are different side effects for different doses of the vaccine at this time?
Yes. So what we've seen is that after the second dose, the side effects may feel more intense. So the most common side effect is fatigue. And roughly 50 to 60% of vaccine recipients will experience some fatigue. And I'll also note that the vaccine-associated side effects generally happen within 1 to 3 days of the injection, rarely more than 7 days out of the injection, but usually more than around 1 to 3 days after the injection. And then the duration of the side effects usually is only 1 to 2 days. So the most common side effect reported is fatigue. And then following that, headaches, about half of people, muscle aches, about a third, chills, as well as fever, around like 20 to 30% of people. Now, when they will report these side effects, they also talk about like the intensity. And so we've seen that after the second dose, the side effects seem to be more intense, as well as in individuals who have gotten the COVID vaccine, the likelihood of having a side effect, as well as the intensity, seem to be more common in younger individuals as opposed to older individuals.
And I suppose it's possible that someone could take the first dose and maybe change their mind on getting the second dose. What would happen if someone were to decide to do that?
Well, I think that if they decide to not get the second dose, then they may not get as robust or as high an antibody level if they were to get the full complete series, like the second dose. Now, if somebody decides to not do the second dose at the scheduled time, the current guidance from the CDC is that if they change their mind and decide to go for the second dose, they still should have the option to have the second dose. There's no reason to repeat the series from the beginning again. But I think it's heavily advised to get both shots in the series.
And I think something a lot of people are wondering, because people are antsy to return back to what was at one time a normal routine without masks, without the social distancing. Once somebody is vaccinated, does anything change, at least in the immediate future, regarding the use of PPE and social distancing? And is there any way to determine how long it would be?
Right. It's kind of asking for a crystal ball, but I like this analogy, which was in an article by a virologist. And so the quick answer to the question is no. Once somebody gets the vaccine, we really want to encourage that we need to practice the other measures that are important for containing this virus. So the analogy is the Swiss cheese model. And imagine there are slices of the cheese, Swiss cheese. And so the holes are in different locations. And in order for the problem to get all the way across, these holes have to be just right or large enough. So our first line of defense for getting this virus out really is the hand hygiene, and then there's a slice of the masking, and then there's the slice of the distancing. And then there's the slice of the quarantining. And I think the vaccine is just another slice. Early therapy is another slice. I don't think that, unfortunately, the solution will be one magical silver bullet of a vaccine.
Right.
It will still be very important that even after we get the vaccine, to practice all the other slices of the cheese, because one, there are individuals who can't get the vaccine ever, because they do have that anaphylactic reaction, or they just don't have the immune system that could make a robust immune response to getting the vaccine. We are always going to have those vulnerable populations. And so as people who are vaccinated, remember, it's not just for your protection, it's for the protection of your loved ones and your community. And so I think that it'll be extra important that after vaccination, we maintain the masking and the social distancing, probably at least until we attain what's called herd immunity. So herd immunity is the concept that there are enough people in the population or in the community that have that humoral or the antibody immunity such that they don't have the ability to take it, get infected, and spread it to the next person. That's one thought. Is the projections are herd immunity around 70%. But I think, honestly, even beyond that, it'll depend on what our local transmission rates are. Because we know that a little ember of a virus in one church can blow up and then the entire congregation gets sick. And we've learned so much about this virus's communicability and really how the asymptomatic transmission, even in households, can be very indolent and go through from household to household that without really knowing. And there are all these problems that are from an epidemiologic standpoint, that to continue with the social distancing and the masking will remain important until we really have zero cases, as close to zero as possible.
And, over the last couple of months, there have been a lot of studies released on how many people were willing or are willing to get the vaccine, how many aren't, how many are still on the fence. And there was the most recent one that was just released this past week actually showed that the number of people willing to get it is increasing, that number is now at 71%, according to one of the local studies that was released. So for people that are still on the fence, or maybe for people who say, at this point, I'm not getting it, can you explain why you feel personally that, it is important that people are open to getting this vaccine?
Well, I think that if there is anything that the vast majority can agree on, is that it has been a rough year. I don't even know if that's the best adjective for it. It has been a hard and, dare I say, terrible year. And if we have any hope of changing the trajectory so it doesn't continue to worsen, part of that has to be in having a vaccine. And I think that the joke I've been saying is that if there's anything we can do to get out of this mess personally, on a personal level, it's literally worth a shot and then another shot in 3 weeks. The effectiveness of vaccines has been clear from polio, from mumps, measles. There are so many other communicable diseases that we have been able to quell thanks to vaccines. And I think as our society has more advanced medical therapy and people have a lot of potent medications that affect their immune systems and their organs, it's all the more important to try and prevent our community from having horrible infections like COVID. So I think that we're probably at a point that everybody knows somebody personally that has been infected with COVID. This is not something that is across the world, like remote and across the world, like not in my backyard. No, it's in our backyards and it's across the street. It's everywhere. And it will continue on like this. It's not going to fizzle out anytime soon, unless there's a concerted effort to try and protect ourselves and continue to protect ourselves, and that would include vaccination.
Having said that, if enough of the population does not get it, say we fast forward 6-7 months from now, and enough people haven't gotten it, what happens in terms of moving forward and getting back to what we once considered that normalcy?
Well, that goes into the other slices of the Swiss cheese.
Mm-hmm.
Then it's the continue with the masking, it's continuing with the social distancing, it is continuing with potentially, also the perpetual burden on our hospitals and our healthcare systems. This has been ongoing so long for the hospitals in our community. It is very difficult to continue the dedication and the vigilance for taking care of too many patients for the hospital. All of our hospitals are over capacity, and not only just the hospital, the ICUs. And it's tough on the workforce.
Thank you, Dr. Lagiovilla, for answering some of those questions. I know that a lot of people have been chiming in, interested in asking their own. If anyone is just tuning in, again, we're talking to Dr. Mary Rose Lagiovilla, infectious disease specialist with Rochester Regional Health, just answering some questions that you might have on the vaccine, the COVID-19 vaccine. First question that came in from a viewer is regarding breastfeeding and whether or not it is safe to get the vaccine if you are breastfeeding.
Okay. Well, I will start that pregnant and breastfeeding women were not included in the clinical trials. It was an exclusion. But I will say that the American College of Obstetrics and Gynecology, ACOG, as well as the Society of Maternal Fetal Sciences, SFMS, have come out with a statement, and it is also supported by the CDC, that because of the mRNA platform that is rapidly degraded after it's been given, it is felt that it is unlikely to be harmful in breastfeeding. And it still warrants a conversation with the obstetrician or primary care physician or a pediatrician to weigh out, is the benefits of the COVID vaccine more than theoretical risk. So where would the benefits be? Well, it might be that this a pregnant or breastfeeding individual is a healthcare worker. And so if they're a healthcare worker and they take care of COVID patients frequently, then clearly the benefit would be more in favor of getting the vaccine for their protection and baby's protection rather than the risk.
I'm going to ask a follow-up to that, not that came from a viewer, but just based off of things that I've seen online and false information that I know now after having talked to some of you guys, which is in the same category, it's infertility and whether or not the vaccine impacts, or the vaccine could impact fertility levels.
I saw those two, and the answer is no. And again, it goes down to that the mRNA is degraded very quickly, and the likelihood of that getting transmitted to reproductive organs is unlikely. So I think those are unfounded.
Now, another question that came in, I think it might be a typo, but I'm going to try and figure it out. If I'm allergic to what I'm thinking is the PCR test, would I be able to take the vaccine?
If I'm allergic to the PCR test. So the PCR test involves usually the nasal swab, and that's just the flocked plastic and cotton swab that goes in there. The contents of that are not the same at all as what the contents of the vaccine are. So I would think that would not be a contraindication.
Next question is, will COVID-19 morph and either strengthen or weaken over time?
That's a good question. I think that we don't have enough information about that. We've only known about this virus about a year, and while we know a lot. We've learned so much. We've learned more about this new pathogen faster and in greater amounts than we've ever known about a pathogen before. We do know about a baseline rate of mutations that viruses tend to do. Viruses are kind of messy. And there have been reports about new mutations, but the correlation to pathogenicity isn't really consistent. So I think that we still need to learn more. I don't think we can predict how the evolution of this coronavirus will be.
And just one more time, I want to introduce everyone again to Dr. Lagiovilla with Rochester Regional Health. If you have questions about the COVID-19 vaccine, please leave them below. We still right now have a couple more to get to. The next one is, if I already had COVID-19 before, should I be concerned?
About the vaccine, I assume?
Does not specify, so it's a little vague.
Okay. Let's assume the question was, if I had COVID-19 before, should I be concerned about getting the vaccine? So I would say no. And I will share, though, that the current guidance from ACIP is that if you have had a coronavirus infection in the last 90 days, given the shortage of vaccines, it's advised to wait 90 days. Mm-hmm. Now, I believe that that's based on, one, from native infection, natural infection, we do create antibody. And there are longitudinal, meaning forward in time studies looking at the durability and the amount of antibody that is made after natural infection. And because we've only had the coronavirus around so long, we only know it out to 6 months. And there's still a little conflicting studies. We're trying to understand who are the individuals that seem to make the most potent antibody responses, and is there a certain amount of time since that infection that it reaches its peak, and how long are they at that peak, and when does it wane? And we're still learning. There are probably factors in terms of age, the severity of the illness, underlying comorbid conditions that impact how high and how much and how long you develop antibody. But they do know that at least for the first 3 months following out, the vast majority of people that are tested do have detectable high levels of antibody. So I think that's the foundation for the recommendation to wait 90 days given the vaccine shortage. Now, following those 90 days, or if you're in an environment where there is ample vaccine, hopefully that'll happen at some point in the future, I would have no hesitation to take the vaccine. I don't think that it would necessarily lead to a larger frequency of adverse events. Mm-hmm. In fact, in the Pfizer study, there was a subgroup of individuals that had evidence of antibody before they got their second dose. So they clearly had COVID infection prior to getting into the study. And when they looked at the subgroup, those subgroup of individuals had antibody evidence of prior COVID infection, did not have a higher frequency or severity of side effects. So I do think that getting the COVID vaccine, if you've had coronavirus infection, will be safe.
Now, this next question, we did already touch on it, but in case this person wasn't currently tuned in when we talked about it, I want to ask you again, do I still have to wear a mask and follow CDC protocol if I get the vaccine?
I'm happy to say it again. Yes, we do. It is important to continue to mask as well as socially distance. And the basis of that is that the vaccine studies are still investigating what is the impact of vaccination on potential frequency of transmission. Like, that data we do not have. That will take months to years to know. When you participate in these vaccine studies, you are involved with them for 2 years. So our first vaccines went into volunteers in May and in June. So we only have 6-month data, and that's even only of a fraction of it. So when you see these numbers of 30,000 individuals or 40,000 individuals participating, we don't have 6-month data on all of them yet. But that is a very important question. We do want to know what is the impact on potential minimizing transmission. So because we do not have the information as yet, the advice is to continue to mask and distance.
Are there certain age groups where the vaccine is okay to get it and where we're not sure how safe it is for certain age groups yet?
Right. So the age range was from age 16 up to, I want to say 91 was the oldest individual who was in the vaccine study. So we do not have data yet on children or individuals less than 16. Those studies are ongoing. And beyond 91, I don't know. I would assume.
If I have Bell's palsy, should I be concerned that it will worsen?
I saw some of these reports, and that adverse event did not come out in the studies, and I think it is really challenging when you have a potentially unexpected event following vaccine. And we've seen this in the past with, for instance, rotavirus vaccine. So rotavirus vaccine, which by the way was a completely different platform also, with rotavirus vaccine, they did studies in tens of thousands of children. They saw the efficacy, how effective it was at protecting kids from rotavirus. And then when it was marketed and given to millions and scaled up, that's when these rare events started to come out. So when you have a rare event that happens post-marketing, well, the next question is, what is the baseline frequency of that rare event in the community? So the rare event in rotavirus it's called intussusception. It is a intestine condition. And so if the frequency of that happening in the study is 1 in a million, but you see that the baseline frequency of that happening is 1 in a million, well, maybe it's not related to the vaccine. But if the baseline frequency is usually 1 in 5 million, well, that's when you probably say, I could attribute it potentially to the vaccine. So we're talking about a vaccine where we have data on 30, 40,000 individuals that's now going to be given to millions. I think that we're going to learn more about some of these even very rare conditions that may happen with vaccines. And I do wonder and share the concern, but I just think it's a matter of what are the unknowns about the vaccine versus the definite knowns about COVID infection. And for me, it's a very personal belief, but I think for me, the known disadvantages and negative effects of COVID infection are just not worth having.
Next question is, do studies show that it would be safe for individuals with autoimmune diseases?
So depending on the autoimmune disease, also those individuals, for instance, based on the medications they may take, may have been excluded from the studies. I think it's a very valid question too. I actually would, my advice would be to talk about that with your rheumatologist or your immunologist, because autoimmune diseases is a broad umbrella for a variety of conditions, and some of them may be mild and some of them may be severe. So I don't think that I could say that for a blanket for in general that they shouldn't get it. It really should be an individualized decision, again, with your direct provider who knows your disease best and how it's controlled or the medications you're on. And then also balanced against, well, what is your risk of acquiring COVID infection?
Just want to introduce again Dr. Mary Rose Lagiovilla with us, infectious disease specialist with Rochester Regional Health. If you're just tuning in, feel free to leave any questions in the comment section as we're going to be wrapping up here shortly. Next question is it safe for cancer patients who have recently completed chemo and radiation, and what would be the efficiency for those patients?
Another great question. I think first, for patients that recently completed chemo and radiation, I think recovering for your body and making sure that you feel well to get the vaccine is an important aspect. Now, and we would even say that for people who've had like coronavirus recently, like if it really should be where you should feel well. You know, we don't stress for any vaccine, for anyone to take a vaccine if they're having side effects of medications or feeling unwell in general. But I do think that depending on, I wish I'd be more specific, but depending on the kind of chemo that you just received, what the impact is on your bone marrow and your immune cells, those are important factors to go into. Not all chemotherapies and radiation will affect the bone marrow or your immune cells the same. And so I would talk to my oncologist. Oncologists are extremely versed in how your B cells are performing, and your B cells are the ones that will make your antibodies. Have a upfront conversation in terms of how is your immune system functioning now after your chemotherapy? Has there been enough time that has passed that I should expect that after I get this immunization, they will function well enough, one, to be a robust response?
We're out of questions for the moment, but I would like to open this up to you to say anything else that you haven't said that you think is important to know, or just anything coming from you, any kind of message that you would like to get out there.
Well, I think that we are really in the pandemic of our lives, and this is really historic, and it is really such a testament to the Rochester community to be able to participate in these vaccine trials, as well as to witness this coalition for major scientific communities to get good science out there. And they've done it carefully, and they've been doing it transparently. And there is information on the FDA's website if anybody wants to go and look at the data themselves that is coming from Pfizer and Moderna. About the frequency of the side effects or the effectiveness on the impact on people's antibody production, looking at those who received the vaccine and those who got placebo. It is very convincing. And I know that sometimes there is skepticism about how successful the vaccine platforms are. I think that, one, they kind of corroborate each other. You know, you have two competing companies that are using similar platforms, not the same, but a similar platform. And yet they've been able to identify nearly very similar and highly effective results. It would be different if the results were completely discordant. But the fact that they are both so reassuring and positive is very enlightening. There's great information on the CDC website about different patient populations and what to expect, and certain type of considerations about should I get the vaccine or not. And there's just great resources. So I would defer anybody to either of those websites.
We have one more that just trickled in, which is, I heard vaccine antibodies only last 90 days. Is that true?
So we, at this time, only have 3-month follow-up to date. So there was the first vaccinees were in May and in June. So, you know, May, well, then you have your 3-week follow-up. So you really don't finish your vaccine series until the end of May. And then you have June, July, August. And so then they have to come in and get their antibody levels, and that's September. And so here we are in December, but there still takes time for data analysis. I know that for Rochester Regional, we have our 3-month, we're going to have our 6 months data follow-up in January. So I don't think that information is completely known yet because the vaccinees are still in that 6-month period. But I think that there is a lot of enthusiasm that they will show to have their antibody levels. And, you know, if they don't, this kind of environment now among the scientific community is all about learning from the prior step to make sure the next step is right.
And I think it's important to note for everyone watching, you know, as we do reach those new thresholds, that 6-month mark in January, we're going to continue having these informational sessions, talking to the public to let them know, you know, any changes, any new information that we can possibly get out there as time goes on. I have one more question for you, I believe, unless that changes in the next minute, which is, should I be worried with Hep B virus with the vaccine, and does it affect the liver?
Good question. For Hep B virus, there is no interaction with the coronavirus vaccine, and it does not affect the liver. There are very stringent blood work that happens in sequence when you're in the trial, and they'll look at your blood counts, they'll look at your kidney numbers, they'll look at your liver numbers, and there were no aberrations.
I know you are a very busy person, so I would like to thank you for taking some time out today to answer some of these questions for everybody.
Oh, thank you. No, it's great.
Thank you again, Dr. Lagiovilla, and everyone out there tuning in. Be safe. Remember, we still are masking, social distancing, and have a happy holiday.
Happy holidays.